name is Mariu Duggan. I am the program director here at Vanderbilt University Medical Center's Geriatric Medicine Fellowship. And I've been at Vanderbilt for almost a decade and a half, trained here in medical school and residency, and couldn't stay away, had to come back to be on faculty after my fellowship in geriatric medicine. Our goal is to train leaders in age-friendly healthcare. We train leaders that are going to go into private practice and deliver care in the community. We train leaders who are going to go into academic medicine and pursue advancing the field of research, pursue education and teaching. And we train health system leaders that are going to go beyond the bedside and take what they've learned during fellowship to improve the healthcare system at large.
So I've been at Vanderbilt for almost 20 years. I came here from the northeast. And Vanderbilt has been an interesting place in that you see a lot of folks who have somehow managed to connect here, whether it be through medical school, undergraduate, fellowship training, who just tend to come back. And I think that's a testament to how special a place it is.
One of the things I noticed first in coming in July into the geriatrics program was that my learning was put first every step of the way. And that takes a little getting used to because we're so used to working really hard as residents and being expected to put service first. And certainly there are lots of opportunities to care for patients. There are plenty of patients and opportunities to be on front line caring for them. But there's also a major focus in the geriatrics program at Vanderbilt that we are to become great doctors and learn how to be geriatricians.
Our clinical services here don't rely on the fellows, and so that really frees up opportunities for fellows to explore different clinical settings that might interest them.
I think one great example of how learning and our growth as physicians is put first is in our nursing home call schedule. I was amazed when we were told we would have one night per month of call, which I really did not think would contribute much to the call schedule burden of work. But I realized that the whole purpose of us taking call at the nursing home wasn't to be a service to the division to give them coverage, but it was so that we would learn what it was like to take call from the nursing home from home, what it would be like to get a call from a nurse in the middle of the night and respond to that and make decisions. And of course we had support the whole way, but the whole purpose was for us to grow and learn and not just to contribute to the needs of the division and the medical center. And that's really a big theme that I've noticed in my fellowship here at Vanderbilt is that if we're in clinic and we're on the wards, but if something comes up where there's a great clinical opportunity or a conference or a didactic that could be really big for us in our learning and our growth, then getting out of that clinic or getting off the wards to go do that was never a problem, and that was given priority.
One thing VUMC offers you is a collegial environment to be a part of family of geriatricians who collaborate extensively with interdisciplinary teams to provide world-class care to complex older adults.
Really, you'll find that one of our strengths here is our culture.
Here at VUMC, the culture really embraces diversity and fosters inclusivity. This enables us to create a great working environment, which I look forward to coming to every day.
I think they try to make sure the program's as diverse as possible. We have an Office of Diversity where they reach out to each and every one of us to see what we need and how they can be really helpful to meet those needs.
We have always been very collegial here at Vanderbilt. All of our faculty are open to trainees at all levels, coming and learning from us, working with us in the clinical setting, and working with us on research projects as well. We try to have one rule, which is you have to learn something useful and it has to be fun. I guess you could say that that's two rules, but really we're all about getting the work done and learning while also growing in our relationships with each other and having fun.
You'll be exposed to over 20 different models of care. Many of these have been developed over the years and have stood the test of time. Some have adapted and changed according to local needs and to administrative requirements. But all of them show you many different aspects of geriatrics. The continuum of care in geriatrics is immense, all the way from intensive care unit care, consultation in a hospital setting, rehabilitation centers, as well as taking care of individuals on an ongoing basis in a primary care fashion.
The entire first month that we've been here has been nothing but teaching and everybody taking the time to really make sure we're getting a good education.
When I came here, I could already tell that the mentorship was going to be awesome. Meeting Dr. Duggan, who's the fellowship director, she made me feel very comfortable. All the faculty that I interviewed with made me feel very comfortable and like I would have this mentorship that I wanted.
I think that the mentorships here are another really impressive part of this program. No matter what it is that you're interested in within the field of geriatrics, there's someone that matches what it is that you want to do, and there are examples of what it is that you might want for your career, whether that's academic medicine, private practice, administrative opportunities. There are so many people that can connect you into where it is that you would like to go.
The clinical experience I've gotten here has been nothing but great.
I'm at several nursing homes, and at the moment we are at Bethany, which is a 180-bed facility, Medicare and Medicaid mixed. We have a large amount of skilled patients and as well as long-term patients, and our fellows have from the beginning been involved in the program here. We have several Vanderbilt nurse practitioners out here as well as other faculty members who come here, and the fellows can learn how a nursing home works. We are going also to Mercy Homes, which is an intermediate care facility for intellectual disabled people, 72 beds, which is very different there from children to old people in their 80s.
I have thoroughly enjoyed my time here at Vanderbilt from 2007 and do not regret the move to Nashville and to Vanderbilt University. I would highly recommend this as a program. Whatever area of geriatric medicine you're interested in, and especially if you're interested in one of these medical specialties where you want to get further training within geriatrics to become a geriatric specialist within your discipline. These areas are taking off in pulmonary, renal, oncology, and cardiovascular medicine, and probably the future of care. I hope that you consider us, and I hope that you will come and join us here in Nashville.